So a stroke happens when blood and oxygen is cut off to the brain, and the brain cells around that area begin to die. The mnemonic that we like to use for stroke symptoms is be fast. So these are the signs and symptoms that you're going to look at. And if you notice them, get help immediately. So the B is for balance. So it is a loss of coordination, stumbling, just can't walk right. E is for eyesight. So you may have blurred vision. You may have loss of vision in one eye, both eyes. F is for facial drooping. So you're going to look at the face as they're drooping on one side or the other. It could be left or right. A is for arms. So you're looking at weakness. Is one arm weaker than the other? That can also extend to the legs. It can also include numbness or tingling in the arm. S is for speech. They may have slurred speech. They may say things that are not right. They don't quite fit in the conversation that you're having. They may not be able to understand the speech that you're saying to them. And then T is for time. So calling 911 is always the most important thing. If you notice any of those symptoms suddenly onset, call 911 immediately. If you or someone else are experiencing those stroke symptoms, the most important thing is to seek medical help as soon as possible. The best is to call 911. That way, an ambulance will arrive to you, they can assess your symptoms, and they can notify the hospital before you even get there that they are bringing in a patient with stroke symptoms. Once you arrive at the hospital, you'll get a quick assessment from a physician, and then you will be taken to CT for a CT of your head. We do that to rule out, to make sure that there's no bleeding going on. Once the CT is done, you'll be evaluated by a neurologist. The neurologist can either be in person or through a teleconsult. While all of that is happening, we'll draw blood to get blood work done. You'll be connected to monitors to monitor your heart rate and your blood pressure. The physicians will evaluate you for a clot-busting medication. The medication we currently use is tenecteplase. That medication is given depending on what symptoms you're having and what time frame you have presented to the hospital. When it comes to stroke, we only have 4.5 hours to give the medication. That time starts at what we call the last known well. So it's the last time that you weren't experiencing stroke symptoms. So that's where your time starts from. By the time generally patients recognize their symptoms and get to the hospital, it's usually at least an hour, hour and a half beyond that. Most patients, when they start experiencing stroke symptoms, kind of blow them off. I'm just going to go and take a nap. We'll see how I feel when I wake up. By that time, when they wake up and the symptoms are still there and they present to the hospital, they're outside of the window for treatment. So we no longer have a medication that can help them with their stroke. So once you arrive at the hospital, our goal is to give you the clot-busting medication within 60 minutes. Our hospital does very good at meeting that, what we call door-to-needle time of 60 minutes. Currently, our best time is 17 minutes from arrival. And that was a patient that had called 911. We were notified prior to the patient coming in. We were ready when they got here, and we were able to do all the stuff we needed to do and give them the clot-busting medication in 17 minutes. Well, strokes are different for every person. Here at Sumner, we have a great rehab team that will come in, do physical therapy, occupational therapy, speech therapy. They work with the physicians and with case management to help the patients plan post-discharge. If the stroke symptoms are mild, the patient most likely will go home. Some patients don't need any therapy at all, and some can do outpatient therapy. If your stroke symptoms are a little bit more severe, you may be looking at inpatient rehab, which we do offer here at Sumner Regional. or it could be an extended care facility to get that rehab over time. So stroke is the number 5 leading cause of death in the United States. It is also the number 1 cause of disability. So we need everyone to be aware of when symptoms occur, to be aware of what the stroke symptoms are. We need you to be fast so that we can be fast in helping you. Our goal is always to help patients be as independent as possible, to get them back to their baseline, back to their normal day of, daily life. And we need your help to do that.